Good evening. I'm Hartford Healthcare's Tina Verona. Thank you so much for joining us for this live Facebook discussion. I'm joined by Dr. Abigail Chua. She is a neurologist and a headache specialist at the Hartford Healthcare Headache Center. Thank you so much for joining us. We've got a lot to get to tonight. This is such a very broad topic that affects millions of people. So first, let's just real simple right off the bat. What is a migraine?
So a migraine is a neurological condition that causes headache, which is what most people think about when they think migraine, but it doesn't just cause headache. It causes lots of other symptoms that people usually don't connect with migraine. So
yeah, I was going to say, this is often a misunderstood diagnosis and treatment, and that's why at the Headache Center there is such a process that you have to go through before you even walk into the door and have your appointment, because you really have to hone in on what the condition is, and there's over 200-300 types of migraine.
Of headache.
Of headache.
Yes.
So, and you know what? Good point. Difference between migraine and headache. What is the difference?
So headache just means pain in some region of your head. Mm-hmm. It's a symptom. It is not a diagnosis. Lots of things cause headache. Migraine specifically is, again, neurological condition that has headache associated with it, but causes tons of other things as well.
Right. So when you have a patient that comes in and they're saying, I have a headache, that just opens the floodgates,
yes,
right?
Absolutely.
So what do you do from there?
So the first thing that we think about when we see a patient who's coming in with headache, first and foremost, is what kind of headache is this? Because there are two broad categories. The first is a primary headache, meaning that this person has headache just because they have that condition. It's either genetic, it runs in the family. But a secondary headache is something, another condition, either a tumor, stroke, infection, some kind of injury that led to headaches. So when we meet someone for the first time, we're asking a lot of questions to kind of find out if they have what we call red flags that kind of trigger us to say, this patient's a little bit different. Maybe we need to kind of focus a little bit more on this aspect, get a little bit more workup done, because this is not just something they were born with.
And one of those red flags that you're trying to sort out or to seek is cluster headache, right? Is that one of them?
That's not really a red flag. That is actually a different type of headache as well. But they do have, every headache type has its own unique features that help us diagnose that. And then based on the diagnosis, we tailor treatment, because it is not one size fits all. Every headache diagnosis has its own specific treatment plan.
You know, and headache, I mean, when you look at symptoms of almost any condition, disease, or illness, headache is in there. So when people suffer from headache, they think it could be anything, but they would never think migraine, right? Do you find that a lot? Do you see that?
Absolutely.
That it's almost like the last resort, or?
Yes. We kind of are sometimes the last resort. Very commonly, we see patients who have thought they were having recurrent sinus infections. So they're going to their primary care a lot, complaining of a lot of facial pressure, pressure here, but not really having classic signs of a sinus infection. No fever, not a lot of nasal discharge, but that same kind of pain in the face. So they're seeing doctors, getting antibiotics, maybe seeing ear, nose, and throat, and eventually once they get to an ear, nose, and throat doctor, that doctor is generally saying, you know, this is not really that issue. You might want to talk to a headache specialist or a neurologist.
And there are so few and far between of headache specialists out there. And
Absolutely.
we're very fortunate at Hartford Healthcare to have you, to have Dr. Brooke Pellegrino, to have Dr. Grossberg. So we're very fortunate to have highly specialized physicians in the area of headache, specifically treating migraine in this area. So that's a big plus for folks around here. And I know there's patients that come from all over the world to see you.
Absolutely.
And Dr. Grossberg, which is so important. Let's talk about the initial process in terms of when a patient comes in to see you or anybody at the Headache Center. There is a lengthy questionnaire, 18 pages to be exact. Let's sort of talk to the viewers about that process and why it's so important that they fill this out before they come in.
Absolutely. So I totally understand that questionnaire is long, and it does take time to figure out, but every headache appointment really is tailored around the patient and what they're experiencing. And sometimes, especially if you're having headaches for a long period of time, many years, it's hard to really think about your headaches. How often are you really having them? It feels like all the time, but what's that exact number? Where does your head hurt? What does it feel like? You don't really think about that every day. You just think, my head hurts. So in our questionnaire, we're actually asking you to kind of sit down, think about it. How often are you getting it? How many times a week? How long is it lasting? Where exactly in your head does it hurt? Because that can really change your diagnosis. How many medications have you tried? Generally when we're seeing patients, we want to start something. We want to make them feel better. But if they aren't aware of what they've tried in the past, or they had side effects but can't remember the medication, it sometimes makes it hard for us to tailor their treatment. Because I don't want to start something that caused them problems before.
And keeping a diary is important too, right?
Absolutely.
So you know, like, what's the weather like when you're getting a headache, or what are you doing when you're getting a headache? Like, you really need to be very specific, right?
Yeah. Well, yes and no. It really depends. So the diary or the log, just by itself, really helps us track how many headaches is the person having, how long are they lasting, and how severe they are. And based on that information, we can tailor treatment. Because, for instance, some women have migraines around their menstrual cycle. So if we see that pattern on their headache log, we can actually treat that headache much differently than we would headaches not associated with their menses.
Okay, so we have a few questions here. Janet asks, she says, I have headache for 7 to 10 days, 24 hours chronic with no relief, then months with no headaches, then it starts again. Is this a migraine cycle of some kind?
So yes, it is a migraine cycle. So a migraine cycle is actually the entire migraine process. So a migraine is not just headache. There are 4 cycles to a migraine, 4 phases. So it starts with a prodrome. The prodrome can cause feelings like irritability, nausea, lack of concentration, fatigue. And this can happen days before a patient even knows they're having a migraine. Then after that's over, about 25% of patients get what's called an aura. So they have either changes in their vision, changes in their sensation when their arms can feel numb, or they're having trouble with speech. And then that can last anywhere from 5 minutes to an hour. After that, that's when the actual attack starts. That's when they get the head pain, the nausea, vomiting, trouble speaking, all of that. The migraine attack phase can last anywhere from hours to days. So, according to her, she's getting it for about a week or so, so that's probably her migraine attack. But after that attack is over, there's still a post-drome phase where patients feel kind of wiped out, not quite themselves. They generally call it a headache hangover. So that entire thing is the migraine cycle. So, even without just thinking about the head pain itself, all the other symptoms, the whole thing is debilitating. So it's important for people to realize that it's not just the headache that counts. You have to be aware of the other symptoms that are happening to you.
What do you want patients to know who might be watching us, who might be suffering from headache, maybe not, don't even know that it is a migraine, or that they have migraine, and that they're sort of kind of out there floating, like, I don't know what I have, but I feel horrible. What do you suggest that they do?
First thing is always talk to your primary care doctor. A lot of patients don't bring up that they even have headache because they're either used to it, they don't want to sound like they're complaining, but the primary care doctor is your biggest resource. They will help you get in the right direction. They'll let you know, this sounds like an ear, nose, and throat problem. This sounds like a headache problem. And from there, they can really start getting the care they need. Very often, patients don't even tell their family members they're going through this because they feel bad. They feel bad, I'm complaining about another headache. But they really have to share what they're going through, otherwise it's hard to get the help you need.
I think it's just a lot of people don't take it seriously enough. They think it's just a headache, I'll take some Tylenol, I'll feel better, or in a few days or in a week, but you don't have to live with this.
You don't. There are so many treatments. Very often we see patients who say they've tried everything, but I promise you haven't tried everything. There's always something new. There are new drugs coming out as we speak. There are new technologies, so there's always hope. There's always something else to try.
And you and Dr. Grossberg, you're on the leading edge of research here. And this is not that we're fortunate to have specialists like you in our area, but you're also on the leading edge of research and clinical trials and so forth. Can you give viewers a little bit of a taste of what you're working on right now?
Sure. So actually, one of our biggest studies is actually the status Migron OSIS study, which actually would be great for patients who are having continuous migraine cycles, having prolonged headache. So very often when patients get a headache that lasts for 3 or more days in a row, they're going to the emergency room or they're going to their doctor and getting treatment. Sometimes this is a combination or a cocktail of meds, but right now we don't really know which one of those meds is actually making a difference. With this study, we're hoping that in the future, doctors will know for this patient, this medication will work. For that patient, this will work. So we don't have to, it's not less of trial and error, more of scientific evidence.
Right, more concrete.
Yes.
So we're talking with Dr. Abigail Chua. She's a neurologist and a headache specialist here at the Hartford Healthcare Headache Center. We invite your questions. We're getting a slew of them in. Shelley asks, what does sharp pain on one side mean then it goes away?
I guess that would really depend on where the sharp pain is. Sometimes, so sharp pain by itself can be part of a headache. It just depends on the other features that can tell us whether or not you're having one type of headache versus another. Also, there's nerve pain that can happen with patients that is not necessarily a headache. So we do treat facial pain as well as headache at the headache center. So depending on if, let's say, her sharp pain is on her face, it could be what's called trigeminal neuralgia. If it's in her eye, it could be part of a certain type of headache. It really just depends where it is.
Okay, we have an interesting question from Peter. He asks, he says, I'm a 55-year-old male with lifelong migraines. A few years ago, I started taking blood pressure meds, including beta blockers, and noticed that my migraine occurrences have reduced. Is there a connection? That's a great question, Peter. Wow,
yes, absolutely. So high blood pressure by itself can worsen headaches because that pressure doesn't just translate to your neck down. It affects your head. It affects the blood vessels that are going through your brain. And if your pressure is uncontrolled, it can cause headaches. It can cause other neurologic issues. The interesting thing is, though, even if someone doesn't have high blood pressure, we use high blood pressure medicine as migraine preventives.
Really?
So, you know, he kind of treated two things with one stone.
Yeah. Interesting. So Natalia says, my husband suffers from migraines at least once a week. I keep telling him he needs to see a specialist. She also wants to know if MSG could be the cause of her husband's migraines.
I love this question. I love this question. And the reason I love it is because of that word cause. So cause and trigger are very often misused and confused. So a cause of a headache can be what we talked about earlier, either a primary condition, you were born with it, it's genetic, it runs in your family, or it could be from some other thing, an infection, tumor, stroke. But a trigger are things that cause what you already have to worsen or to come out. So MSG is what we call a trigger. You already have headache, but you're either eating something or drinking something or doing something that your body doesn't react well to, and that can cause the headache to start.
Interesting.
MSG is one of the known triggers.
Really? Is it common? Do you see that a lot?
So triggers in general are common, but everybody has their own
different triggers. Yeah. And that's where I think the diary comes into play, right?
Absolutely.
Is that you want to know if there are trigger migraines, what is setting it off? What is triggering that migraine, right?
So finding out your triggers is very empowering to patients because, you know, yes, we can use treatments, yes, we can use medications and procedures, but to give that patient some sense of control, like I know if I don't do this or if I do that, I can actually control my migraines myself, it's very empowering. So it is important to kind of find your triggers. That being said, I also kind of warn against looking too much into triggers because really the goal of migraine or headache medicine in general is to improve a patient's quality of life. Right? And if I feel if someone is spending too much time looking for triggers, they're not really enjoying their life because they're avoiding everything. Yeah, so that's the hard part with triggers.
And maybe they might be getting tunnel vision too, so they're not looking at the complete picture, right? Because they're sort of focused in on a certain subset, right?
Absolutely, absolutely. One thing I always hear is chocolate is a trigger, right? And this applies more to women. Wine also. But there is such a thing as a craving for migraine, during migraine. So I kind of explain to women, men won't understand this as much, right? But women, when some women get their period, they get a craving for chocolate beforehand. So they eat this chocolate and then they end up getting their period. Did that chocolate cause their period? No. It was a craving during that whole process. A very similar thing can happen with migraine. So you can crave something, either salty foods, sweet foods, chocolate, and then get your migraine. So it's really hard sometimes to say, was it a craving or was it a trigger?
It is so specific.
Yes.
I mean, it's like right down to, I mean, you really have to fine tune this. I mean, and your job as a physician is to really sort of weed through everything, figure out, A, is it migraine, and B, what's causing it.
Well, the
There's
whole
so many
thing
factors.
is very, very much a partnership between the provider and the patient. We can't do it without the patient's active participation. So the headache logs, them kind of just paying attention to what's going on in their lives, and then talking and sharing all that information. So no information is too small. Everything, that one little detail can make a huge difference in their care. Yeah.
Right.
So communication is key. Tell your headache specialist everything.
We're talking with Dr. Abigail Chua. She's a neurologist and a headache specialist at the Hartford Healthcare Headache Center. We talked about women and migraine brought on by the menstrual cycle. Cluster headaches, you often see that in men.
Yes.
Why is that?
It's a completely different migraine headache type. Again, there are 300 different types of headache. The cluster is just more common in men, and it is very, very, very different than migraine. The symptomatology is different, how it presents is different, how it feels like and how people respond to the attack is very different. And it often does get confused with migraine because migraine can cluster, meaning that you can have attacks at certain points, they go away, they come back, so they look like they're clustering. But a headache that is clustering does not necessarily indicate a cluster headache. Very, very different.
Wow. Yeah, there is so much to this. It's so fascinating.
Lots of little nuances.
Yeah, it's so fascinating. You mentioned 200, maybe 300 types of headache, migraine. What do you see the most of in your practice?
The most common is probably migraine. Migraine in the United States is super common. It affects 1 out of every 4 households. So you know someone with migraine. All of us know someone with migraine. They might not be telling you they have it, but there is someone we know.
Is there a genetic link here?
It can be, yep. It is more common in women. And then also, when it tends to run in families, the children are more likely to have migraine. And it can present differently in children than adults as well. So that's also something to be aware of.
So when you talk about children and presenting, and children cannot always convey how they're feeling, what should parents be looking for in their children?
So in children, you can have head pain, but generally sometimes these kids are just a little bit more withdrawn. There are symptoms that are part of the migraine picture that cause a lot of vomiting in kids. They get maybe a little bit of vomiting, then the headache, and the kids won't really tell you that. So you have to kind of look at them, are they wincing? Is the lights bothering them? Do they want to go in bed and cover their head? All those kind of things are just little clues. But actually, little kids are pretty good about saying, my head hurts.
Right.
So all of those things are important. If mom or dad has a history of headaches and the little kids start saying that, it's a red flag to just kind of pay attention a little bit more.
Can you develop migraine later in life if is that something that can happen?
That can happen. So in general, it generally starts when you're younger, but it can happen in your 20s to 50s, 60s, 70s, 80s. As we get older, though, it becomes more of a red flag because it's not as common. So when someone who is, let's say, older than 50 is getting their first ever headache, it makes us kind of, our ears perk up a little bit to say, what's really going on here?
Right, and then that's a whole other diagnostic set of tests that you would have to go through,
Absolutely,
right, at that point? We have a question from Rebecca. How do hormonal changes create migraine? Do they get worse as we hit our 40s?
That is a great question as well. So every hormonal milestone in a woman can affect headaches. So they can be brought on by the menstrual cycle. They can improve or worsen during pregnancy. And then they can improve or worsen during the perimenopausal stage as well. It really depends on the type of migraine a person has. So there are migraine with aura, or those neurologic symptoms I mentioned earlier where you can get speech changes, visual changes, numbness in the arm, and there's migraine without those symptoms. Generally, women who have migraine with aura react a little bit differently to hormones than women without aura.
Right.
So again, that history is really important.
What about vitamins? I know magnesium sometimes is often used for people with migraine issues.
Yeah, so nutraceuticals or vitamins and minerals are often used in the right patients. We can use magnesium. There are different types of magnesium, so it is very important to speak with a provider before just starting magnesium, because it has to be the specific kind. We use B vitamins called riboflavin. We can use coenzyme Q10. Sometimes certain herbs are used as well. They can all have their benefit in terms of headache, but it is really important to realize that even though they're natural, doesn't mean they're side effect free, and it doesn't mean that they won't interact with the other medications they're taking. So these things need to be discussed with their provider.
Absolutely. What are some of the other treatment options that are offered for migraine sufferers?
So actually this is a very exciting time in headache right now. We've had our medications for a while: anti-blood pressure, anti-seizure, anti-nausea medicines, migraine-specific medications called triptans that are meant to fight a specific attack. But there are new classes of medications coming out called calcitonin gene-related peptide. It's meant to be very migraine specific, and we actually haven't seen that in a really long time. It's very, very exciting. We also have onabotulinum toxin that we inject, can use as migraine prevention. And we have devices that fall into the neuromodulation category. So these devices affect the nerves that are affecting centrally, going into the brain, affecting where migraines we think start. So they're changing the outside to help fix the inside.
This has to be so rewarding to you as a physician, because you see people coming in at their worst, and you're often, you know, I hate to say it, almost the last resort. You know, they've tried everything, or they've been to other doctors and they've had one diagnosis, and so by the time they get to you, it's like, you know, what do I do, you know, and please help me kind of thing. And it has to be so rewarding for you to sort of, you know, really investigate, zero in, kind of hone in on what it is, and then treat them, and then they come back and their life is literally changed.
Absolutely, absolutely. So I actually have migraine. So I know what it feels like. I know how it can impact your life, and I actually had headache daily and continuously for many years before.
Is that why you chose to
I think
go
subconsciously
into?
I just enjoyed treating that patient population, probably because I just understood what they were going through. But when I see a patient and they're getting better and they come in and they're crying because they finally were able to play with their grandchild, or they went back to work, or, you know, do something they enjoy, even just simple as going to a movie without having pain, that is so rewarding. It's like little things that we're the people who kind of understand, you know, because we see it every day. A lot of neurologists also have headache. A lot of headache specialists have headache, so we kind of get it. We understand.
Yeah, so there's that personal story there too, along with that passion to help people. So it's a perfect blend for you and your patients. I'm always fascinated by what happens neurologically when a migraine comes on, or during a migraine. What's happening in the brain?
Do you have several hours to talk about that?
Let's do it.
So that's a very complex question, because we don't fully know the answers yet. We're learning more and more each day, but we don't quite know everything. So the theory behind migraine pathophysiology, of what starts migraine, has evolved over time. People used to think that it had to do with the dilation and changes in the diameter of blood vessels, but now we really think that migraine is in really a primary neurologic issue. So there are centers within the brain that are being triggered and causing this whole process to start. But not only are there certain triggers inside, our nerves on the outside, so our peripheral nerves, specifically things like the trigeminal nerve, can get activated and irritated and sends pathways back down into our brain that sets off this whole cascade of pain signals. Different neuromodulators, different neurotransmitters get affected. And then it starts not only spreading from the inside of your brain but to the outside. And that's when people start getting that throbbing headache. Interestingly, there is a thing called allodynia, or sensitization. That's when the headache is actually evolving to now include the outside of your skin. So things that shouldn't hurt. People say that, you know, my hair hurts, and it sounds so strange, but people's hair can definitely hurt. They have to take their glasses off, they have to take their earrings off, their clothes just bother them, because everything is irritated at this point. It doesn't stay in your head, it can affect your whole body.
Wow, can't imagine what that feels like. I'm not a migraine sufferer, but you know, I know people that are, and to see them go through that is it's debilitating. It's for these patients. In terms of treatment, and we were talking about stimulation, are there like sort of neuro stimulators that you can use to sort of redirect signals and feeling of pain sensation?
Absolutely. So currently there are several FDA-approved devices that can be used for migraine or headache prevention and also headache treatment. So some of these are used every day, and over time they decrease how many headaches come on. But when you do get one, you can also use that device to treat that specific headache. Also, not just, I know we're talking about migraine, but there is a device that's actually meant for cluster headache as well. So this is very exciting because cluster headache can be very debilitating. It doesn't respond to standard headache treatments that we would use for migraine. So having a device specifically made for that patient population is great.
Yeah, I also want to point out too another thing when you walk into the headache center, the dim lighting. I think that's really important to. It's a small feature, but such a vital feature.
Absolutely.
You know, we're here in this studio with all these bright lights. Probably not good for
not
a
good
migraine
for,
sufferer. But walking in, that was one of the things that when you designed the headache center, that was so important on the list. And makes a huge difference.
Absolutely, yeah. So we do try to keep it dim. Some of our patients have asked if we had trouble paying our electric bill, but it is meant to be dimmer to kind of avoid that light sensitivity that a lot of migraine patients get. Also, we are scent-free, meaning that we encourage our patients and their family members who are coming in with them to avoid heavily scented perfumes, lotions, shampoos, that kind of thing, because those scents linger and they can trigger migraines for a lot of people.
Yeah, for sure. It's just so fascinating to me that there's just so much that we've learned about migraine and still so much more to go. And I think that's why the research is so important, in the fact that you and Dr. Grossberg and Dr. Pellegrino are really on that leading edge and directing that research and a part of it. So we're very fortunate to have you here. And I know we've literally just scratched the surface of this. I mean, we can talk all night about this. But thank you so much for your questions. And if you do have questions, feel free to write them long after we've concluded this Facebook Live discussion. We'll get those to Dr. Chua and answer those questions for you. But Dr. Chua, thank you so much.
Yeah.
There's a wealth of information, and we hope that it helped you out there, migraine sufferers, or knowing somebody that you know that is suffering from migraine. I'm Hartford Healthcare's Tina Verona. Thank you so much for joining us. We'll see you next time.